When you say it's my opinion, I say it's evidence of science. And here is where the evidence of science is. This is in regards to that guy who died at the hands of a spine surgery, bleeding to death when he had complained several days before he died to the doctor that he couldn't breathe and that, his chest was getting full and swelling from bleeding. He didn't know that it was bleeding, but the doctor told him that it was not unusual for him to have the symptom that he had. So 3 days later, he's dead. So, and it wasn't a heart attack like the medical examiner. I'm telling you, people, get a second opinion and quit trusting these folks. So what I'm going to do, I'm not going to show you all of them, but these are the lung sections. I'm not going to go through all these sections. And you're going to have this all section of lung. You can show where he has hemorrhage in his lung, even from looking at the naked eye of the slides. And then we're going to go into the sections of, I'm not going to show you the sections of liver and spleen and all that because they were already normal. But here are some of the sections of the adrenal gland, and I wanted to show you a section of heart so I can show you that it wasn't a heart attack. The evidence of fact is under the microscopic histological analysis of the heart. So just stand by. So let me remind all that doing elective surgery, there must be a standard of preoperative evaluation. So this man was cleared for surgery, remind you all. So while he did have some moderate atherosclerotic coronary artery disease, and even some calcification in the medial wall, and even along the plaque there's calcification, the lumen was widely patent. As you can see here, the lumen is very widely patent. And so like in 90% of us, a lot of us will have some form of atherosclerotic coronary artery disease after 50 years old. So this man was 60 plus years old. And so obviously there is some calcification, atheromatous plaque. But the lumen, as you see here, is widely patent. So he was getting adequate blood flow to his heart muscle. And now we'll go and look at the heart muscle itself to show you that there was no evidence of an acute heart attack. So I usually take sections of the right ventricular myocardium as well as the left ventricular myocardium. So we're starting with the right ventricular myocardium, and I'm going to go to the outside here. Well, that's still the inside. Let's see. Let's see where we are. All right, so this is right ventricular myocardium. It has a little more fatty tissue. That's normal, anatomic normal fat in the right ventricular myocardial wall. But if you can look at the cells, the cardiac cells are very normal. There is no hypertensive changes and obviously no evidence of ischemic heart disease or acute heart attack. These are normal histology of myocardium. I'm going to go to the left ventricular myocardial tissue. So here's the left ventricular myocardial muscle tissue. Very normal histology, no evidence of ischemic changes, no evidence of acute MI. So when you allow these so-called medical examiners to, this is just a close-up view, to tell you that your loved one died from an acute heart attack, then that's what you're going to do. So always get a second opinion and challenge that which doesn't make sense. Your husband goes in for an elective procedure and comes out 3 or 4 days later dead. Now, if Joan Rivers can get fairness, injustice in the cause of her death during an elective procedure, then so should this person. Thank you.